Welcome everyone to Denver Health Medical Plan Elevate Your Health educational video channel. And today we are here with Kaylee, who is the manager of our government products team. Hi, Kaylee.
Hello.
How you doing?
I'm well. How are you?
I'm doing just fine, thanks. First, I kind of wanted to start off on who you are and what the government products division of Denver Health Medical Plan is.
Yeah, so my name is Kaylee Krisier. I am Manager of Government Products, specifically on the Medicare product line. And I, in this role, perform a lot of different responsibilities. So the Medicare team is really responsible for all of the members' benefits and organization of the plan and how we ensure member experience, proper benefits, all of the member materials that come out, really just making sure that the program is running smoothly for strong member experience as well as regulatory compliance.
Oh, okay, great. That's a lot of work. So that's we want to kind of cover some of just the basics for people entering into Medicare. So as we know, when you turn 65, you're eligible to be on Medicare. And that's typically something that people get through the state, and they get the original Medicare. But Denver Health Medical Plan has the Elevate Medicare Advantage plan, and which is also kind of known as Part C. And so, what happens if somebody has original Medicare and then they sign up for Part C?
Yeah, so when you sign up for your Part C after original Medicare, all of your care is managed by that plan, and that includes your prescription drug coverage. Anytime you have questions, you should reference your plan materials or reach out to the plan directly. Another big difference is while a Part C offers all the same benefits as original Medicare, they also offer additional benefits. So this may include benefits like dental, hearing, vision, transportation, and more.
Awesome. So it's kind of a benefit because original Medicare is just basic. And if you sign up for an Advantage plan, somebody else is managing that for you. It feels very much just like regular insurance, and you get additional things like the transportation and what you mentioned. So that's kind of amazing. It seems worth it to me. If somebody is a member and they get all of their materials from the Medicare Advantage plan, it being like Denver Health Medical Plan in this case, if they need replacement materials or like a replacement ID card or a replacement Medicare card, what would they do?
Yeah, so there's a couple of ways in which you could get a replacement material or card, one of which you can create an account or log in to a member portal and print or request a copy. You can also always contact the Health Plan Services Department and they can get a new card mailed to you or a new material if that is what you were looking for.
Oh, okay, that's awesome. So, and our member portal is located at denverhealthmedicalplan.org and just click on the member login tab. So, if anybody out there is wanting to know where to go, we'll put that up here on the screen for you. Thanks, Kaylee. So when it comes to a Medicare Advantage plan, what resources are in place to help members navigate their plan?
Healthcare can be complex and challenging to navigate, so annually you should familiarize yourself with your benefits and resources. Some of those important resources you could use may include the plan website, the denverhealthmedicalplan.org, our member portal, and documents which are mailed to your home. If you ever need help finding information or you have questions, you can always reach out to the plan's Health Plan Services Department for additional assistance on navigating or getting those materials provided to you.
Oh, awesome. So can Denver Health Medical Plan represent a Medicare Advantage member if they're not satisfied with the medical care they're getting at their provider?
So yeah, if you're not satisfied with your medical care, we can help you. We're here to help whether you need help finding a new provider, you have questions about referrals or authorization, or anything really related to your benefits and getting needed services.
Oh, that's great. Really cool. Can a health plan representative at DHMP help a member access their providers in the Medicare network?
Yeah, they can always help with that as well. So you have access to the provider directory online and your evidence of coverage. And that evidence of coverage explains your coverage with the plan. It will tell you what you need, including whether referrals or prior authorizations are needed.
And so are referrals required for Medicare?
They may be depending on the service. So again, familiarizing yourself with that evidence of coverage is always recommended before you get a service. But if you ever have questions or concerns, reach out to the health plan and we'll be happy to assist and answer that question with definitive
Oh, okay.
response.
Oh, awesome. Okay. And so, sometimes when people go in and they just do their preventative care. Oftentimes, diagnostic testing is something that their doctors will start doing for them. So, do all Medicare Advantage members need prior authorization for all diagnostic testing?
Yeah, and every benefit's always a little bit different, so you should always refer to your evidence of coverage prior to getting any service, just to confirm that that service is covered. However, your doctor should have an idea of what is covered under your benefit plan and be directing you along that process.
Yeah, that's really great. I think, whenever I'm over at an appointment, I've started getting into the habit of asking whenever they say, I'm going to recommend this, I say, do I need prior authorization for that? And I think it's really helped because I've noticed that when I actually ask the question, they know, the doctors know, oh no, you shouldn't need it, or yes you should, and or someone from your health plan will be reaching out. So it's always good to advocate for yourself, I think, when you're on your appointments. So I'm just going to put that out there as like little tidbit of advice. Always ask, right? And so do our Medicare Advantage members need referrals for specialists?
No, but you should always refer to your evidence of coverage prior to getting any service to make sure that you have everything that you need in order to have a seamless visit.
And just as a reminder, that evidence of coverage is available on their member portal, correct?
It is, as well as available on our website.
Very cool. Awesome. Thanks. And then, so a lot of times people are just concerned with their out of pocket costs. So, what out of pocket costs can someone expect to have when they're on a Medicare Advantage plan?
Yeah, good question. Every member is different depending on the plan that they're in, their low income subsidy status, which is also referred to as extra help, and then the services that they need. So as a member, it's a great idea to review your evidence of coverage to understand what costs you might be responsible for based on services you use and what your out-of-pocket maximum is. If you have any questions, make sure to contact the plan so that we can help you prepare.
One of the last things I wanted to ask you about was, would you be able to talk us through the steps a new member needs to take when they enroll with their new Medicare plan?
So when you enroll in a new plan or a Medicare Advantage plan, it's really important to become familiar with your benefits. You never know what you need until you need it. But as an Elevate Medicare Advantage member, we mail out a quick reference guide which talks about what you should do upon enrollment. This may include scheduling an appointment to establish care, setting up your medications, scheduling an appointment to see the dentist, or scheduling an eye exam. Maybe you need to schedule a ride to get to your appointment, and then you should log into the member portal. These are great ways to kick off your benefits and make sure you're getting needed care quickly.
Okay, so Kaylee, going back to that quick reference guide that goes out to all members when they enroll, what is like that seems like a really good tool that they could keep and be able to manage some of their health care. What exactly in there, what is included in there that you think would be helpful for a member specifically?
Yeah, so that quick reference guide is really a great starting point for members to understand what benefits are available readily and in a digestible format. That evidence of coverage is a great resource. It really breaks down every benefit that you have, but it's very long. It might be challenging to read. And so that quick reference guide really pulls out those key important benefits that we feel a member would need to know, and then provides the information on how to use that benefit or how to act upon that to sort of empower or allow a member to advocate for themselves and use these benefits because they're really there for the member. We want you to use your benefits and have them if and when you need them.
Kaylee, when it comes to our network, If someone signs up with a Denver Health medical plan, Elevate Medicare Advantage plan, do they only get to go to Denver Health Hospital?
Yeah, that's a great question. So no, the Denver Health Medical Plan or Elevate Medicare Advantage product serves with a number of network providers. So in our network, we have Denver Health Hospital and Authority, we have UC Health, we have SCL, we have National Jewish, and some Stride or Champa network as well. So there's really a robust number of providers who help service the Denver metro area that our members have access to.
Oh, okay. That's really great to know that they have this wide network. That sounds like hundreds of doctors that they would be able to have an opportunity to see if they needed to, right?
Absolutely, yeah. It's important to get care when you need it and get care quickly. So make sure to visit a doctor that you feel comfortable with.
That's awesome. Thank you so much, Kaylee, for your time today and helping us answer some of the just basic questions for people getting started on a Medicare Advantage plan.
Absolutely. Thanks for having me.